On my own. All right, all right. Did you guys enjoy your lunch? Good. I didn't get to eat it, so I'm glad. So I'm just kidding. But thank you. Good, good, good. Well, thank you so much for sticking around and joining us for our next discussion. Again, my name is Jade Curtis. I'm the executive editor of BlackDoctor.org. And so during this panel, we'll be shedding some light on the pivotal role of early detection in cancer in the Black community. So today we are privileged to have the distinguished group of panelists who bring us their expertise from various sectors. So starting to the left of me, could each of our panelists introduce themselves?
Sure. I'm Ricky Fairley. I'm the CEO and co-founder of Touch the Black Breast Cancer Alliance, and we are about eradicating Black breast cancer. Happy to be here. And I'm a 12-year survivor of triple-negative breast cancer.
And hi, everyone. My name is Deanna Distant. I'm a product director supporting our prostate GU portfolio at J&J, or Johnson & Johnson Innovative Medicines now. It's a pleasure to be here. I've spent my last 3 years supporting our health equity efforts. Excited to share that with those insights with you, but also a proud daughter of Haitian immigrants and amazed to be at this seat today to really share some of those insights. So nice to meet you all.
Good afternoon, everyone. I am Sandra Graham Mason with Regeneron. I'm a senior director on an oncology product, and I get the opportunity and the privilege to help educate patients about their condition and why they're being prescribed this medication and how to advocate for themselves. And then the second hat I wear at work is to work on our health equity working group team, which is a part of our DE&I efforts, and really trying to do community outreach to help educate individuals like we're doing today about conditions that really impact us as a community. Thank you and happy to be here.
Yeah. Good afternoon, everyone. My name is Marvin Lampkin. I am the director for the Illinois-Indiana markets for Genentech. That's one of my jobs. The other two jobs that they don't pay me for is that I am one of our health equity ambassadors. I also lead our disparities of care, community of practice, as well as lead the D&I efforts for our Midwest region. So really excited to be here and look forward to the discussion.
Hello again, my name is Deirdre Johnson. I'm a Senior Vice President, Porter Novelli. I lead a team of Jedi champions and warriors across the globe. We do work in the health equity space and also diversity and inclusion.
Awesome, 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 awesome. So cancer, as we know, does not discriminate, but the impact is not felt equally across all communities. So statistically, African Americans have the highest death rate and the shortest survival of any racial or ethnic group for most cancers. So addressing these disparities require us not only to pay attention, but also create actionable, life-changing strategies. So let's go ahead and dive in. So this first question I have for Ricky, Deidre, and Marvin. How transformative can early detection be for public health overall and also specifically for the Black community? Let's start with Ricky.
Sure. Well, let me give you some facts. Thank you for your facts. First of all, I have to say that I'm very grateful to be a part of the Black Doctor family. And, you know, we have three shows on the network, and it's a great platform to communicate all this information to Black women with breast cancer. But the facts are, Black women have a 41% higher mortality rate of breast cancer than white women. We have a 39% higher recurrence rate of breast cancer than white women. Black women under 35 get breast cancer at twice the rate, die at 3 times the rate of white women. And we don't know why. Black women are 3 times more likely to die of triple-negative breast cancer, which is what I had and my sister Michelle has. And so it's a horrible disease. Black women with breast cancer have three times more likely to develop cardiovascular disease after they have treatment with breast cancer. And then I could go on and on with the stats. And so it's so important. We can't prevent breast cancer. All we can do is early detect it. And so the sooner we know about it, the more important it is, for our lives. And so we actually have an HBCU internship program. We just started 15 last week. I don't know how we got to 15. We usually have 10, but my daughters can't say no to anyone. But they're all pre-med, these badass, amazing young women, and they basically communicate with their families. We ask them to make a video with your mom and your grandma about breast health, to bring these conversations to the Black household. Well, guess what? We don't talk about health until Uncle Pookie gets his leg amputated or Grandma Edith is in hospice. And so we get them to sort of stimulate these conversations with their families and with their peers. And we think it's so important for them to make these conversations happen so that they can know their bodies, know her stories, talk about these conversations. And we try to promote breast health as an act of self-care. We have a campaign called For the Love of My Girls that's very fun and interesting and cool and hip. It's 18 to 35-year-olds who don't have disease, so they can talk about it. And we give them tools to sit down with their grandmothers on both sides and talk about, who had what and who died of what. So we have to talk about early detection. We have to make them know that this is something that you have to honor. And really, you should learn it in high school.
Absolutely. Marvin.
Yeah, I'll kind of touch on something that Reggie opened up his conversation with, is around prostate cancer and early detection. Black men die. The delta between Black men and white men in terms of mortality is about 140%. There's no reason in most situations that a person should die from prostate cancer, right? It is the probably slowest developing cancer out there. And so we all know the problem. Part of it is trust. Part of it is the system and the way it works. But the other challenge is Black men don't go to the doctor, right? We need your help there. And so, but from a systems perspective, we had in my former company, not Genentech, because we don't have anything in the prostate cancer space, we were meeting with a system in St. Louis. We were trying to talk about some things around how do we help with prostate cancer detection, because we were really committed to eliminating or helping to eliminate that mortality gap. So we were meeting with their chief diversity officer, their VP of population health, all these different folks. And so all of a sudden, the chief diversity officer, who also happens to be a PharmD, states, hey, it's interesting that you bring this up, Marvin, because I was just in my primary care office and I had to make him give me a PSA, right? Or a prostate cancer screen, right? And I was like, serious, you have to make him do this. His pushback was the U.S. Preventative Task Force guidance states you don't need to do a PSA at this stage, right? Now, he worked for the system. He was a pharmacist, and he was the person responsible for making sure there was health equity across the board. So imagine him being pushed back like this. So part of the reason is that guidance did not really take into account African Americans being high risk. And so that was one of the challenges. But imagine what was happening to the ordinary Joe who was walking into that system. So we really sat down and said, how do we get past this, right? And so when you start talking about early detection, again, there are things we can do to eliminate this, right? If we can get help from our mothers, sisters, girlfriends, spouses, because those are the only people that's going to help us get to the doctor, right? If you catch us in an emergency room and you got us there, hey, talk to us about the pros and cons of getting a prostate cancer exam, as well as one of the most important things we as Black men need to understand when it comes to prostate cancer: what is your family history?
Yeah.
Right? And we all know the dynamic that kind of challenges that, right? And so when we get back to what's the importance of that, it is absolutely vital, because too many of us are dying of prostate cancer or cancer in general, especially in this situation. We can do something right now to kind of close that gap.
Absolutely.
I would just add understanding your history and the impact it could have on your children, because you could be in a situation where you're more likely to be a candidate or to have a condition because your father did or your mother did. Understanding that if you don't ask and advocate on your own for biomarker testing, which is something that they aren't going to just offer you if you don't go in and say you want it, because it's expensive, but that could be the difference in saving your life. Having those conversations, but then as a communicator, being able to tell the stories and show real people allows people to see that it's not scary, that you don't have to wait till you're in the emergency room and your wife has nagged you for 3 weeks to go to the doctor, right? To see that it's not a scary thing, that the test is easy. And once you have it, you have the information to make effective choices.
Can I add one other thing? Because there is a part of this test that is scary for Black men. That DRE, or that digital rectum exam. I know women, you're like, look, but embrace that uncomfortableness, And also, at the very least, you should have the blood test. At a minimum, you should get the blood test if you are not comfortable getting the DRE, right? But don't walk away from the entire screening process because you are uncomfortable with that DRE. Because as a lot of my friends have told me, I am not getting that, right? So,
But that 5 minutes of uncomfort could lead to 30 more years that your wife has you or that your daughter has you. And so I just want to push
you
people
got to say that
to
because
say-
another brother saying that.
Don't worry.
You got to say that, right?
Don't worry. We do. We carry that banner because I would much rather him be mad at me for that 5 minutes to know that he gets to see my kids grow up.
And I want to make a quick note, prostate-specific antigen, PSA, that screening is gold standard. It depends on your urologist or oncologist. Some of them will prefer to do a DRE because that additional detection can help them detect certain tumors and better understand that. But for the most part, what we preach when we do our Talk That Talk, which is the campaign we work on, we do tell men it's a simple blood test because we know if we lean on the DRE piece, we're not going to get men to go in to the points mentioned before. A simple blood test is a big difference in saving a life.
Mm-hmm. Wow.
Can I add one thing? I think also, there are a lot of risk factors for cancer that we can be aware of, and we're not as a people. And we're actually doing a study right now with Johns Hopkins among young women on hair dye and tattoos.
Mm-hmm.
So the same chemical that's in hair dyes is in tattoos. And we're basically asking them, will you stop doing this if you know it's going to cause cancer? So it'll be interesting to see what we find out. But I think there are things that we all do in our lives that could be preventative if possible, and some cancers are.
Mm-hmm.
But, we don't always adapt that behavior. And I'm not sure why. Is it because we don't believe it's going to work? We don't believe it's going to affect me. It's not going to happen to me.
Mm-hmm.
And then it does, and your mother has it and whatever.
Yeah. Absolutely. Absolutely. So, over the past decade or so, there have been efforts that have been made to raise awareness about the importance of early detection. But I guess the question remains, have we seen any traction with that in the last 5 years? Go ahead. Yeah.
Yeah, I'm happy to take this one and kick us off. So I'd say first and foremost, I support a campaign called Talk That Talk. The whole mantra behind Talk That Talk is really ties nicely to what Ricky mentioned, this idea of breaking down stigma and normalizing these conversations. When we think about the insight that inspired this campaign, it was really grounded in the fact that we all have these hard, difficult conversations. We talk about the birds and the bees. We often, as Black families, have to talk about police. And also just in general, why can't we make the same conversation happen around prostate cancer and your health? Because we know health is wealth. Ultimately, when we think about the transitions in terms of where we've come, I can tell you 3 years ago, I was in a copy approval meeting having difficult conversations on what we could message to as a pharma company because the guidelines restricted us, much to what Marvin stated.
Mm-hmm.
So when I think of progress, I can tell you a couple of years back, our website actually still dated now. A couple of years back, we did not have the ability to really speak to Black men the way we do now when it comes to telling them, hey, you can get screened as early as 40. Mm-hmm. The guidelines used to say 45. And 5 years makes a difference. If you look at NCCN guidelines today, we've seen great strides and efforts made to be more inclusive, meaning we're tapping into the right advocacy organizations, getting the right support to create these guidelines, knowing many times the people who sit on these guidelines don't represent the community at large. And so when I think of what I see today, we recently saw an amazing effort brought forth with the NCCN guidelines that were published for early detection in prostate cancer a couple weeks ago. They actually cited that Black men benefit more from screening than their white counterparts. And instead of doing screening every other year, it's now annual. That data and seeing that transformation take place from a guideline perspective gives hope because we know there's so much we can do to inspire Black men to get screened, but we still need those physicians to be receptive when they're trying to lean into cultural awareness and support their patients of color in the healthcare system. The other piece I'll also make, and I highly encourage all of you to Google this, is the PSA screening, the HIM Act. It was introduced by Representative Bobby Rush, as well as Representative Larry Busham. And right now, essentially, that would remove cost sharing, meaning removing a systemic barrier that often prevents men from getting screened to begin with. If you're a high risk, which is connected to African ancestry, this bill would really help transform that and remove that cost sharing piece. So highly recommend when you have a chance, Google and write to your legislative board and congressman and let them know to help support pass this bill at a federal level. But those are examples of progress that I see that are so critical that we need, because when we talk about these efforts, the reality is there's grassroots efforts we can do, but there are still systemic barriers that exist. So to really address social determinants of health, we need to think of policy. family. We need to think of things beyond just our communities to really shift the momentum forward to really help save lives.
Yep, I want to jump in here too. I feel, overall, when you look at have there been progress, I would say yes, but that's inclusive of everybody. But when you peel back the onion and you're talking specifically about Black people, has there been have progress been made? And a little bit, very incrementally. And I feel that you can make a difference, and the differences can be made by having the awareness. One, eliminating the barriers that you talked about. Access to care is the number one thing that needs to happen, because you've got to get into that doctor's office and be able to cover that expense. Secondarily is how we continue to educate with each other. And then third is your zip code should not equate to your level of competency. Because even before I ever got into marketing, I was a sales representative on these streets in Manhattan talking to doctors. And I would just have the pet peeve whenever I would talk to them about a product and then I'm told my patients won't understand it. And back then I was in a subservient role, so I couldn't challenge the doctors to say, well, how do you know? Did you ask them? And chances are they didn't. So those kinds of things really do make a difference. But you do have the American Cancer Society as an example, where they're also saying it's suboptimal. They are trying to, do early detections, have more conversations with people so that they are aware and then have decision and feel empowered so that they can take care of their own care and be advocates for themselves. The same with ASCO, which is the largest organization for cancer research. And again, those doctors have taken on this challenge by saying, how do we continue to educate other doctors so that we can then treat people accordingly? And if an organization such as ASCO has taken on this challenge, that doesn't mean that we shouldn't embrace it and be a part of that conversation as well. And that's something that we need to do, be a part of the conversation and stop being afraid. And as Ricky said, when you hear about Uncle so-and-so has his leg amputated or somebody has cancer, oftentimes we're hearing about it once it's metastatic or it's so far like end-stage renal disease or something to that effect. And now the damage is done and now we're afraid. But had we had that conversation early on and talk about, in the phase 1 of this condition, your creatinine levels might be this, have that conversation so that when you talk about your generation, your legacy, they can also have the conversation, feel empowered when they go into those doctor's offices.
Absolutely.
Can I add one thing?
Of course.
And I think what's great, you guys have guidelines for breast cancer. There are no guidelines. The latest guidelines basically say that black women are at higher risk, but we need to do more research to figure out when you should get a first mammogram.
Yep.
And we know the data showing we're dying younger. So I think we still have a lot of work to do in the breast space to get policy put in place that reflects Black women.
I agree with you, Ricky. Another thing, I work in lung cancer, in advanced lung cancers. That's another one that really impacts us negatively. And even with biomarkers that you mentioned, which is a standard to determine which drug on the market will actually work for you. Oftentimes, I read a retrospective study where it showed in Black men, even in doing biomarker tests, they still were not being given the standard of care. They were still being given suboptimal care, like a chemotherapy, when they're like newer therapies that are available and they're not being given that opportunity. So one, ask for it. And then two, when you get the results back, like, okay, what were those results? And now what are you going to do about changing my course of treatment? So those conversations do need to take place.
Can I build on this one real quick? Because lung cancer is probably something that everybody doesn't talk about until it happens. But the screening for lung cancer is single digits in every state. Single digits. So in the state of Missouri, it's 8% of eligible patients get screened for lung cancer. Single digits, right? And I can't remember if there's one state that's in double, but it's in most cases, it is single digits. You're not even getting to 10%, right?
Really
and
sad.
so if you got somebody who is high risk, we won't get into the criteria around that. I would encourage them, hey, be proactive. Right? The more proactive you are, the better your outcomes.
And
right?
don't feel because you're not a smoker that you're immune to it.
Yes.
The secondhand smoke will impact you. And then there are other determinants of health that we talked about that can make you also a candidate for these horrible diseases. So don't feel like you're immune because you're not.
It's unfortunate, but it's on patients to also do their own research so that when you go, you understand your condition and can ask the effective questions. because like we talked about before, they might not give you the option for the treatment even though you got the biomarker
Right.
test. They might just put you into chemotherapy and you spend weeks doing something that is not going to have the same level of ability to kill the cancer.
Right.
So understanding that there are other options and knowing that before you go in helps you to then be an advocate. And don't be afraid. I've been a patient before who asked questions and people didn't like it. But sometimes you have to do that. It's your health. And if you don't advocate for yourself, sometimes if you don't have a family member who can go with you, you don't have that extra help.
But that's why it's so important to have something like a blackdoctor.org, because
Yes.
people have a place to go to get information of trust. And I know from our work in clinical trials, which is a whole nother conversation, because we know in breast cancer, the drugs aren't working for us because we weren't in the trials. But it's really just understanding that we have to give them information in words they can spell from voices of trust. And that's why we don't believe it. Our culture, our community doesn't believe it. So we have to kind of use these assets to be able to help them understand what they need to know and how to talk to doctors. And as Michelle said, to demand the care they deserve.
Absolutely. Yeah, and I'll jump in here just
Yeah,
on the BDO tip. We actually recently launched a cancer resource center to educate patients about how to talk to their doctor, to give them the information they need, and also give them personal stories.
Yeah.
So they can hear from people just like them who have been through things, or someone who can maybe speak to them in a way that they understand. Because hearing a Black man say, hey, go get screened, like you said, they don't hear that. We hear it from the women, which of course is super impactful as well. But hearing it from the men, it's powerful.
It is powerful.
Yeah. Absolutely. Absolutely. So with so many approaches to, successfully get Black people screened, which do you think have been most successful? How can we improve on the ones that we have?
I'd like to start. I think providing screening vans, tools that reach people where they are. If you have to wait months to get a screening, and then if they find something or it's inconclusive, months to have the follow-up. If you do have a condition, it's worse by the time you start treatment. So meeting people where they are, so working with community health organizations, bringing the testing and the treatment tools directly to the people, eliminate the transportation barrier, eliminate the access barrier, eliminate some of the cost barrier. If you can provide a free breast screening or a free prostate cancer screening, and you can do it in places that they might be more willing to do it. Like figure out if the barbershop is willing to have a safe space where you can have that conversation, or the women's group or the sorority or the church. Figure out where is that safe space that they're going to go and offer it to them there.
Yeah, and
I was going to say, we find that we have a lot of success going to events that aren't health related. And, we did 70 events in the community last year. I like to say we go where Black women live, work, play, pray, and slay. I added slay to you. But we did a bunch of events for our When We Trial program. We were able to sign up 15,800 Black women for clinical trial portals last year. But we find that we're more successful when we catch them off guard. The people at the health fairs we're preaching to the choir. But the people that are on the beach in Martha's Vineyard in pink bikinis with us, we can talk to them. We partner with really all of the community organizations, all the sororities, Jack and Jill, and all the Black organizations. When we go to their events, then we have more traction because they aren't thinking about health, and we put it on their mind from a different perspective, and they listen and they hear and they want to sign up. So I think it's how you approach it. But when you go to the health fair, you got all the old people trying to check their blood pressure, as opposed to the young women who could be having these influential, and I'm old, I can say that, have all these influential conversations with their family because they heard it on the beach at Martha's Vineyard, or, when Bougie Black people were there. They heard it at the Essence Fest. They heard it at Mardi Gras. So.
And what I can add, if I'm summarizing, I think what's being shared by a lot of our panelists is this idea that there is a national play on how you can engage, but there's also this important local grassroots effort that you need to balance and strike that balance. Yes. And when I reflect on Talk That Talk, I talked earlier when I introduced myself that it's a privilege to be in the seat because I have a seat at the table. And so there's a heavy onus that I put on me bringing the right people at the table to have a conversation, because I'm N of one. Our communities are not monolithic by any means. And so when I reflect and think about what we were doing to find the right channel to inspire Black men to talk, much like Marvin said, we really took a step back and said, let's talk about the psychographics of the men we're talking about. Black men are not all the same. We're talking about our older Black men who were children of the civil rights movement, who probably grew up seeing segregation impact their homes and also impact the hospitals where their families visited, but also younger Black men who are maybe more open to wellness, talking about mental health, but also realizing that they're still movers and shakers and have all these big aspirations, and they grew up in the digital age. Thinking about that intersection, we asked ourselves, who could speak to both of these men? Who could inspire them beyond the family and communities that have lifted them time and time again? And we landed on Shannon Sharpe. So Shannon Sharpe, it was really serendipitous. When I speak of him, everyone knows him as Ankh. He is very tall in person. But I say that to say, you know, taking a step back, we opened and had a conversation with him to say, hey, we think you would be a great face for our campaign. We think your voice could really inspire others to take action. And not knowing at the time, he actually was screened early and got diagnosed with prostate cancer and had early intervention and became one of the 96% survival rates that Marvin talked about, knowing that if you catch it early, you can survive prostate cancer. And so I take a step back to say, when I think of inspiring channels, it's not just this flashy, let's go with the big talent like Shannon to help inspire. We still need grassroots efforts and support and sponsorship to really bring that to life. But I'd also say, more importantly, it's about staying true to what the Black experience is. If I think about talking about cancer in general and how you really inspire, it's also reminding people that oftentimes the experience of Blackness often is depicted in pain and suffering. So when we think about what we did with our campaign and what I think many of us are doing today in this room, it's about reminding and finding the intersection between health and Black joy, reminding people that to choose their health is to ensure that generations after them can really embrace joy. And that in itself is truly like a form of growth and health and goodness.
Can I? I'm sorry. Go ahead.
Yeah.
Go ahead, Marvin.
No, I was just going to add one of my things that I'm really passionate about that I see often is there's this challenge of, yes, in the community we are driving awareness, right? But when you go to the point of care, right? Is your provider or are your providers going to be willing to give you that test or that screening exam, right, at the appropriate time based on the criteria that's given to them, right? The only way for us to really combat and close this gap is that, and somebody said this in an earlier panel, we need to be super advocates for ourselves. So they need a blackdoctor.org to have that information and say, hey, I'm reading this. I know there's some family history here. It doesn't matter if it's prostate cancer, lung, colorectal, breast. We need to be armed with that information. So when we walk in, the criteria says this, I should be getting this. No, you're going to give me the exam, right? I'm going to do this, right? And even though it's scary, because it's cancer, right? But understand, to your point earlier, if you catch it early, your outcomes are so much better.
Right.
That is a fact across the board.
That is true.
And
Better to
Marvin,
know than not know.
and I'd also just underscore, this goes back to just even the prior panel when we were talking about our physicians, right? I know you spoke a lot about cultural humility and this idea of moving away from cultural competency, because they can't know everything, right? We're just human, we're infallible. I'd say, if anything else, what's equally important for us when we think about inspiring people to re-engage in the healthcare system is the fact that they can hit that wall and meet a culturally unaware physician that's gonna really dismantle the advocacy they're trying to live into, right? And so I think what's equally important, we're doing so much great work where we're investing in building the next generation of physicians to be more diverse, but those physicians are not going to be with us for another 10 years. That's a huge gap in care that we need to address. So it's equally critical that as we support and uplift our general public and inspire them to take action, we're doing the same in educating our providers to meet them where they are and to really lean in, to be culturally aware and be thoughtful about the conversation they're having with these patients, much like Marvin said earlier.
Yeah,
You
and
know,
when you talk about things like moonshot, for example,
Yeah.
10 years is a lifetime.
Yeah.
And if you're waiting that long for these doctors to catch up with moonshot, for example, if we are truly getting new therapies coming out of that research, then you need to make sure our medical colleagues can keep up with that as well and ensure that we are giving people the right opportunities and the right treatments that are ideal for them. Because I do think we're going to be getting to precision medicine where we can then go in and I can individually say, this is me, you have my blood, and these are the drugs that will work for me and my body. And that's kind of where we're going, and we're heading in that direction. And the last point I wanted to make, and then I'll turn it back over, is, like I said earlier, I work with our DE&I office. I volunteer and lead this health equity working group. And one of the things we do believe at Regeneron is that if we have good science, and also working with our community, as well as ensuring that our internal employees understand, then that then spills out into the community organically. And being able to speak to someone from a grassroots effort to say, you know what, I went to school with this individual, I remember them, I trust them, I know them, they know my experience, because we have lived shared experiences. I'm more willing to potentially listen to you telling me about a condition that you have and how it manifested in your life, versus sometimes just going to the celebrity and feeling that this is just a spokesperson who's being paid, and I don't really know if this is a part of your life or not. So I do agree with having national spokespeople, but I then also feel that you can have regional people that we can rely on, because everybody's community, you have those people that everybody knows and everyone trusts, and they're highly engaged within their communities. And those are people that we can also engage with.
And I can just piggyback off of that. When I'm interacting with my audience, kind of poll, what do they interact with? What gets the most engagement? It's those personal stories. Those personal stories are like, oh, that's literally someone just like me.
Yes.
Like if they can
That's
go
what we
through
talk
there,
about.
or if they can get screened, I can do it too. I can survive too.
But that's why it's so important, the voice of this information, because I can give hope to people, to my breast cancer sisters. I mean, my doctor gave me 2 years to live. I took some experimental drugs and I'm on 12. And so, but that's what we do in our stories. And I know my sister Michelle is gonna thrive as well. But I think it's the stories that make a difference. And frankly, I don't think we can wait for our community to get the information and the love they deserve from doctors. And as Michelle said earlier, we tell patients all the time, you go back to that doctor and say, is that treatment what you would offer your mama, your auntie, your grandma, your daughter? Because if it's not good enough for your family, it's not good enough for me. But I know where I have more power. I have more power not trying to change the mindset of a 50-year-old white oncologist, but I can change women, and I can educate Black women, and I can give them the tools they need to get the care that they deserve. And that's what we focus on, and that's what we have as a platform for Black Doctor. And I think that's, as an advocacy group, that's what we do best, is educating our peers to say, here's how you talk, here's what you ask for, here's what you demand, and without any question. And so we spend, I call it ego boosting. We're going to have an ego boost session today, because this is what you're going to go tell the doctor.
Yeah.
But that's how we have to coach them. And then right now we have, I guess, almost 4 years worth of content on our Black Doctor, on our Doctors In show. So we pretty much have talked about every aspect of breast cancer. So I refer people back to stuff that we shot 3 years ago. There's a show about TNBC. I know it's somewhere, like I'm going to go find it for you, but that stays around forever. And we have it as people. The one thing about cancer is that every day we get new people in our family. Every day. Every day more come in, every day die. So we're always refurbishing or resurfacing stuff that happened to somebody else, because now it's happening to you.
Sounds right. Go ahead.
And I did want to add something more so as an industry representative at the on the panel with some other colleagues too, is the important notion of how you think about transformative mindset within your organizations of why this work matters. I think more often than none, what's critical, and kind of the mantra we lived into when we were building our team to lead this work, was this idea that it's never too late to do the right thing. But I want to be thoughtful about what that means. As you're standing up these efforts, please know the community remembers. When you stand something up only to a year, the well is dry and you pull away and you go back, because that's happened time and time again. And that actually erodes trust significantly more than just not doing anything to some degree. So please be mindful as you continue to engage with these communities, the sensitivity, delicacy of that trust, and that building trust takes time. It takes time to overcome 400 years of systemic issues that these communities have faced. So we need to do our part to be thoughtful about that, knowing that 3, 4, 5 years, it's going to take time to really heal as a community, but also drive equitable outcomes for our Black patients.
Can't do the flavor of the month.
No.
Show up at the dinner party, buy the chicken, and you're gone. Doesn't work.
All right. Any final thoughts before we wrap? Go ahead.
I have one I just want to say, and it was from conversation that took place a little earlier around clinical trials. I do feel that a lot of pharmaceutical companies, including mine, are working diligently to incorporate more people of color into clinical trials and trying to understand the impact of what that means so we know how these drugs will work for us. But one aspect of it that I think that does get lost is that we are not talking about these communities practices. If your community practice is not affiliated with a national academic institute, how are we expecting these doctors to actually take those protocol and be a part of a clinical trial? They're not staffed to do that. They may not have people who understand how to collect these data. And if the data aren't submitted in an appropriate way, then it's going to be excluded. And again, we're excluded again from something that we're trying so desperately to be a part of. So I just think when clinical trial money are being disseminated, they also need to be looking at those offices within communities that are not a part of academic centers and ensuring that they can be uplifted as well and be a part and have a voice heard from their patients.
If I can offer one last thing, I would encourage blackdoctors.org, if you do this again, move this across the country. I think it's a wonderful venue to get this message out. I would also strongly encourage you, bring in the folks that work at the point of care, right? Because what we got to get our heads around, if we zoomed out and we do all this advocacy work, pharma does its part, health advocacy's done its part. If we don't have the health system, right, the actual point of care present, then that's where the challenge really lies, right? So we need that dialogue to happen across every facet of healthcare in order to make these changes stick. So thank you, guys.
We're actually doing that from an advocacy perspective because I don't trust that doctors are going to bring it. So we're actually now working on specific clinical trials for some of our pharma partners where we bring in a nurse navigator. And basically she talks to the patient at the point of contact, that when the patient shows an interest in a trial, she becomes the fairy godmother to keep her in the trial. She explains the informed consent, but she role in the care process. So we do non-medical services, so we don't interfere with the trial, but we have a navigator on our team that basically can coach patients because I don't trust that they're going to get coached properly. So we're helping these pharma companies recruit the patients and then keep them in the trial to play an active role in that whole conversation. So we have to do the work.
Yeah.
Wonderful, wonderful. Well, thank you all so much for joining me. This was amazing.
Thank you.
All right, what an outstanding panel. Please give it up one more time for that incredible panel and those panelists. Just wanted to peel back the curtain real quick, just a personal story myself, and give kudos to, I believe it was J&J that have that Talk program. So I have not only a father, but an uncle, both who had prostate cancer. My father had prostate cancer first, then my uncle, my father's brother, was diagnosed with prostate cancer. It's during that time that we started to have those conversations. We started to do and listen to those talks. So we started to talk the talk, but that led to walking the walk. So that led to actually going to the doctor, doing other measures to make sure that, hey, my father, my uncle are still around today. It's because of those conversations that we had and that information that we received that now I'm able to still, talk to my dad and my uncle and go for my own prostate cancer exam that just happened last month in December. I'll be 48 this year, so I waited a little longer, to get mine because of, just like they talked about, the stigma. I don't want to, I don't want to do that. But when you have these conversations like this, it needs to be done because these are loved ones we're talking about. These are family members, and it affects all of us. One last thing before we move on to the next panel. One panelist said, your zip code does not equate to your intelligence. I was like, that's a mic drop moment right there. Sometimes we use the geographic area to determine or make quick judgments about people, what they want to do, what they don't want to do, but then that's not right. Being able to look at the entire person, the whole picture, as so many of our panelists do today, is just so important when it comes to really changing the tide, moving the needle, and really making systemic change. So I want to thank all the panelists today so far. We've got one more exciting panel coming up. So we'll start in about 4 minutes.